Good morning. Thank you for joining me, Saga, and my awesome co-host, Morton, today. It's our 8th episode, and we have the lovely Jay Dodhia from Serene Care and Mark Anslow from CarePlanner.
Yeah, great to have you on board, guys. Maybe just a few words about you and what you do, so everyone that listens into this recap of the Health Plus Care debate about digitalization know who you are. Shall we begin with you, Jade?
Hi Sanga, hi Morton, hi Mark, and hi to everyone out there. Palvi and I set up Serene Care a few years ago. Basically, we used to work in investment banking, and we thought there had to be a different model to revolutionize care. So what we used to find was that there used to be, two extremes and high disparity in the market. So you've got, all singing, all dancing, purpose-built homes, which are hotel-type accommodation, charging hotel-type pricing. And we found that was not really affordable to all. But on the other hand, you had these very tired and dated conversions. And so we thought, okay, why don't we buy one of the ones at the lower end with low occupancy, which is kind of, failing effectively, come in and fully refurbish it, which we do in line with dementia guidelines, put in the same furnishings as you find in high-end homes, create, facilities and spaces there. And then we fill up the homes with local authority residents without top-ups, but it makes them viable, it makes it financially turn around, and that's what we've been doing. So we've got a couple of homes now, and hopefully buying our next one soon.
That sounds really, really, really good, Jay. And I know that you and Palvi are really into technology and also thinking about this when you're setting up your services. And one of those guys that are doing a lot with technology, that's you, Mark. Welcome.
Hi, thanks, Morton. Yeah, so my name's Mark Anslow. I am Operations Director at CarePlanner. You may have come across us. We're a software as a service platform mainly directed at home care agencies. I've been with the company since it was founded back in 2012, and I've worked in various capacities across the business. So I have worked with the development teams, and I've worked with more operational customer-facing teams. So I've got a fair idea of how tech can work in social care and some of the gotchas along the way.
Really good. And then just to introduce what happened at the Health Plus Care show, organized by Michael Corbett and the Closer Still team, which was, by the way, a really, really interesting and hyper event with a lot of talks and a lot of things going on. But regarding technology, what we experienced was a really, really good debate about whether or not the right way forward for social care innovation was through digital transformation. And on the one hand side, we had a few debaters, Sanga and Jay. You both represented the yes side. And then we had Lorcan from CarePlanner, and then Adam Pennell from the IHSCM. And I think it all ended very smoothly with us agreeing on a lot of aspects. But to unfold them here today, here you are. So shall we hear from you first, Jay? What were some of your points?
Sure, Morton. Can I slightly correct you? I don't think it was the right way forward. It was the best way forward, because we're not saying, and that was the key crux of it. We're not saying it was the only way forward. It's not just the way forward, but it is the best way forward, because without digitization, all other way forwards are compromised. And that was the crux of our debate. So even the United Nations thinks that, internet access is considered to be a basic human right. Yes, something that you and I take for granted, checking an email, doing a Google search. There are over 2,000 care homes in the UK today that do not have Wi-Fi in their homes. And, a lot of several thousand more than that don't even offer, access to their own residents, even if they have the service. So that's an effect on their human right, I would say. Coming back to the other side of it. So what we're saying is that without having this very basic technology in the home, there is no way we can drive further innovation or transformation in there. As providers, our primary aim is the safety and well-being of our residents. So why would we not take advantage of the opportunity digitization brings us to, have early intervention to prevent hospitalization and keep them safe, but also to let our residents remain connected to their families and the wider community. And using technology became a necessity during COVID, as we know, when that we had lockdowns. So why is that not something that we would continue to push forward by digitization? Why do we need a pandemic to force us to innovate and transform the industry? The other thing is, my own parents who are in their 70s are very comfortable using technology. And I may even say they're addicted to their iPhones and iPads. So they are the next generation of the people that we will be caring for. Without having some sort of digital offering, then surely, just to remain relevant, care homes will need to be providing this. But without having this digital transformation strategy, they will not be able to go on that journey to make them keep themselves relevant. And then we all know that the biggest challenge right now is staffing. It's, the biggest challenge as a provider that I face, recruiting and retaining my excellent staff. I mean, it's unconscionable not to relieve this pressure and burnout if we can find a way to utilize something that has been proven to improve the quality of the consistent care received by our residents, relieve the burden and the burnout that's felt by these overwhelmed staff. From our very own experience, we have found that it is more efficient to automate these menial and repetitive tasks by using systems, which in turn allow our staff to actually spend more quality time with our residents, providing that person-centered care that we want. And then it allows us as management to actually analyze the data rather than just working on inputting it. Because I'm sure, everybody wants to look at fall trackers and trends and analysis, but when you're too busy just typing it in, trying to work it out, when are you ever given a chance to sit back and actually look at the forest away from the trees? And, it provides a better outcome and evidence for all stakeholders, I think.
That's some really good points, Jay, and I'm pretty sure that, and quite contradictory, that someone like you, Mark, who works for and have been a part of CarePlanner for that long, that you've just mentioned, 10 years anniversary. Congrats on that. You have some ingenuity and some other way into this dialogue, since you're advocating another perspective. And can you recollect some of the things that you and Lorcan were discussing?
Yeah, absolutely, Morton, and thanks for that, Jay. I think you put the case really well, and there's a lot of what you say that's irrefutable, and I'm not going to contest it. Instead, I think what I'd like to do is try and sort of back up a bit and say what we have a problem with is not use of technology. Clearly, that would be ridiculous. We're a technology supplier, and we've seen many agencies become more efficient through using our platform and similar platforms. What we have an issue with is the language that this is all couched in. So we talk about digitization, and we particularly talk about digital transformation, and we've seen Sajid Javid being wheeled out doing the rounds recently, kind of bashing social care agencies, saying they're not digitized. 40% of them are still floundering around using paper, using printouts. And we've got a couple of issues with this. First, it's not true. The more you dig into those kind of sound bites that he wheeled out, the more you find out that actually there are an awful lot more agencies, particularly in home care as opposed to the residential space, who are using these systems. And a lot of it is so automatic that they don't think to necessarily describe it as a digital system. So when carers use WhatsApp to communicate back with the office, or people jump on a Teams call, we don't think of that as digital transformation post-pandemic. We think of that as just our day-to-day work. And yet someone from Ipsos Mori comes along with a clipboard and says, "Are you digitally transformed?" And someone starts to scratch their head, and that goes down as a no, and so gets translated up onto a policy level as, well, this sector is back in the dark ages, and we need to come in and digitally transform it. And I think that's our second kind of area of concern, is that it's all very well for Sasha Javid to take the podium and complain about lack of digitization in social care and how they need to step up to the level of the NHS. But these are small, cash-strapped, heavily regulated businesses. They don't have the time or resources to go out and engage with complex policy debates about what joined up solution they should have in place. What they need is to be able to quickly go out to market, find a suitable piece of technology for their agency that is not going to alienate all their staff and pigeonhole their service users, but fits right into their business and their way of working, and then incorporate that. So just to recap, we're not saying technology bad by any stretch of the imagination. What we're saying is technology needs to be adopted from below rather than imposed from on top.
That's a really good caption and a good way of taking that in. Just to to wheel you in here, Sanga, because you were obviously also there on the day, and John Wilkes was obviously there with a larger bus than the one I've got today. But what was Sanga? What do you say to something like what Mark's just said there now?
No, I would say yes and no to what Mark is saying. I completely agree to the fact that the language needs to change. The way we describe digitization, or even digitalization and digital transformation, all those things needs to be really clarified. And the way, when people ask me and I elaborate, is, are you all on papers? And I agree with what Mark is saying, that knowingly, unknowingly, we use components of technology, but we don't say that we have digitalized, or we have digitized. But if you peel back the layers and and try to define for the sector what does digitization means, I would say, are you mostly on paper? Is there a space where you could use technology as a tool to create more value for your people? And if it is yes, then you should go and find that tool to help you deliver that time and resource for your people. Then the next layer is about digitalization, where we are talking about, are you only in some kind of an Excel or antiquated system? Because that is not actually going and helping you to achieve that resource for your own people. So then you embark on that journey of digitalization. And then the third layer, which is, I have seen in my experience in social care, there are only very few companies who are thinking about a connected, integrated ecosystem of technology which helps them deliver better care. And that's what digital transformation is all about. It's about using connected systems which are able to talk to each other, interoperability, how you are using the data from each of these systems. Is it actually going and helping you in making decisions on time? Are you able to take preventive actions, like Jay was mentioning? Are you rather, we as a sector know how safe my environment is from the repeated audits that my business is doing and tracking and recording, and using an AI kind of aspect to throw in data points to understand, I have to go and take preventive actions now before it becomes very late. And you and I, we have often debated about, technology these days are in a position where you can start understanding and, really taking that preventive health in its advanced stage. So, can we reduce the number of hospitalization? Can we reduce the number of UTIs that is happening? And these days, it's possible. So that's where my angle is, that yes, I agree, we need to change the language, we need to change the narrative, because technology at the end of the day is just a tool. It can be as good as bad based on how you use it.
Yeah, that really brings me to what I remember being Adams and Lawkins' bang on perspective, and what moved them from a 2 out of 10 on the audience parameter to a 7 out of 10, or wherever John ended that. But I definitely felt it was a 7. It's the organizational aspects, and actually what's concerned with making this all about people again. And Mark, I'm pretty sure that you and Lorcan have conspired on some of that too.
Yeah, absolutely. In fact, I can get a little plug in here that last night we were delighted to win silver in the European Customer Experience Awards for people at the heart of the business, which is fantastic, and we're dead chuffed. But in some ways, and I hope it doesn't sound arrogant, we weren't too surprised by it, because it's what we've always set out to do. And I think Lorcan said, we take our lead from the companies that and the agencies that we serve, and that's how they treat their clients. And so we like to offer that same support to the people using our software. And it is more and more evident that when you're using these complex care technologies in highly pressured frontline environments like care, it's the human side that enables. You can have all the dashboards and machine learning that you want, but unless you've got someone to tell you how to interpret that, someone to keep the systems running, and as Jay says, the time and space to actually sit and look at that data and make data-driven decisions, which isn't a given, right? That doesn't come as part of the technology package. That's something you have to carve out of your day, um, to get the headspace to look at. So I think there's a huge human component to um, digitalization or technology adoption that's easily glossed over.
When we're talking about, or what's essential in this debate is, of course, the word innovation. And for me, innovation means that we used to do something in one way, and now we're doing it in another way, and it's widely accepted, it's widely implemented. It means we're at a new stage of something, and whether that involves technology or not, and this is what we're debating today, if it is or if it isn't, or if the best way forward is with technology. And I think, Jay, would you have any
Yeah, what I would like to say is that when people think transformation, they think it's a big idea project that everything has to change, everything has to be disrupted. You have to, rip out everything and start from scratch, from, like you said, top down. And that's not true at all. The best way to transform that we've found is by doing it in baby steps. Like Mark, when you mentioned WhatsApp, we take that for granted right now in every business. You're saying it's in the field. But remember the first time that first business used WhatsApp to get. I still remember the first time we used WhatsApp, created a group with our carers. This was just, or when the pandemic was starting. And for us, it was transformative. Suddenly, rather than having to call the home, call different people, we could put one message in the group. All the carers would know exactly what's happening with the resident. If there's a shift being covered, you put it in the group, and you have people rushing or wanting to help. It was transformative, and that was a very small step. So don't look at get caught up in the language. Don't get caught up thinking it has to be highly impactful. Small steps will get you there.
and what do you all think? And then whoever comes first will win this one. What do you all think about? Obviously, we're talking a lot from the perspective of workforce right now, and talking about all the people that will use some kind of a tool differently in their work life. But what about all the people that they all take care of? What about that perspective?
I think there's a huge amount that technology can do there. I think particularly in a residential setting, and I hesitate to talk about that because it's not my area of expertise. And with the likes of Jay and Sangha on the panel, I'm going to be at a disadvantage. But I still think, if I'm a care recipient, I am much more interested in receiving well-funded, consistent care from somebody who turns up looking, happy and enjoying their work than I am with any amount of technical wizardry behind it. And that's what I'm kind of conscious of at the moment, but you're right, Jay, we shouldn't get carried away with the phrase transformation, but the government narrative at the moment is the reason social care is failing is because it's not sufficiently digitally transformed. And we know that that's not true. We know that the reason social care is struggling is underfunding, it's recruitment, it's the knock-on effects of Brexit. There's a million and one kind of big reasons why things are happening. And if we allow this debate to become too far skewed towards the pure digital, we risk giving the government a get out of jail free card on tackling the really big issues that we face.
Yeah, absolutely, Morten and Mark. We shouldn't be talking about digital transformation as digital transformation. We should be talking about transforming the sector using multiple tools, using technology as a tool, using data as a tool, using, some other aspects, which I don't know, new things will be coming up. Who knew social media is going to be one big industry even 8 years ago? There are so many innovations, so many new things coming up. And I think we as a sector, we should be open to those changes, those innovations, which is changing everything around us, our lives. And social care is our life. It's life. It's not like the classical retail banking sector, which can have its own entity outside your day-to-day life. Social care is just pure life, full stop. So it cannot avoid all the other things that's changing our life on a day-to-day.
Very well put, Sangha, and I totally agree, and I can see that our other guests are agreeing with you too. So just to wrap up, do you think that when Adam Pennell and everyone else from the audience, Lorcan Murray, everyone who participated, when they listen into this, do you think that they think we've done a good enough job telling the story of what happened and the perspectives, Jay?
Well, knowing Adam as I do, I think he'll disagree because he knows he does best always. But no, I think he will try and hopefully say that we have, tried to put out a fair uh, uh, point of view of what it was like. But at the end of the day, I think the point he made, and that what Sang and I completely agreed with, was it's about the people. Social care is not about anything else. We are all here in social care because of our residents. Without them, there is no social care. And so if you put the people at the center of everything we do, then it's worth doing. Otherwise, if we try and make it all about digitization, or we make it all about the environment, or like we said, anything else, then it doesn't work.
Yeah, that's a really, really good point. I think it was stated at the Oxford Styles debate that someone, at least, I think it was you, Sanga, said technology in that respect is really just an enabler.
Yeah, I think they would look at it and take from it that actually this is a debate that's just going to run and run, isn't it? But I think that underneath it's fundamental what Jay says, that actually whilst this debate runs at a given level, underneath people are choosing software packages, and they're choosing systems that work for their agencies. And meanwhile, residents and service users are interacting with technologies. They might have in-home fall detectors or in-home monitoring systems. So there's a kind of there's our hypothetical arguments about it, and then there's what's actually happening on the ground. And I think that the right systems adopted in the right way, in the right hands, is still the way to go. Let's just make sure we get those rights squared up.
I completely endorse what Mark said. Those 3 R's, the rights, are so important. To all the listeners who are listening to this engaging discussion that we are having today, one thing that I want them to take away, if not everything that we discussed, is this realization that technology is just a tool. It is, whenever they're going and choosing a technology, whatever it is, for resident communication, or for employee engagement, employee journey, or even something to help them with decision making, data, for example, they need to think in the people lens.
That is true. You need to find that sweet spot for your strategy and the vision you have, and then include the values of your company or wherever you are in terms of finding the right solution for yourself. And with that, we say thank you to Mark Anslow and Jay Dodhia for joining us for the recap of the debate. Take care.
Thank you very much. Take care.
Thank you guys for giving us the opportunity to recap it.
Thanks very much, guys.
Thank you for listening. Don't forget to subscribe, review, and share your favorite Take Care podcast with your friends and colleagues. Until we meet next week, take care.